clinical hypnotherapy. Um, and I am working as an assistant professor of psychology at Harriet Ward University. So today, what I'm going to do is I will be talking very briefly about how hypnosis could help women who are pregnant, and also whether hypnosis will be able to help prepare women for childbirth and also during the postpartum period. So, by the way, the babies in these photos are my clients' babies. They were born through hypnosis. So, just very briefly, WHO stated some time ago that all pregnancies are potentially very risky. And each day, around 800 women die of pregnancy and childbirth-related complications, for example, bleeding or infections. And if you look at the diagram here, you probably had experienced women, having pregnancy symptoms, or if you had pregnant before, you know that you do have, you may have experienced some pregnancy symptoms like mood swings, particularly morning sickness like severe nausea and vomiting, of which scientifically we call this as hyperemesis gravidarum. Now, people who have hyperemesis gravidarum tend to be very anxious. The reason is that when women are pregnant, they want the pregnancy to be very smooth, and it is a happy occasion for them. But what happens is that when they keep on having these severe bouts of vomiting, nausea and vomiting continuously, particularly every morning when they wake up, it leads to the series of experiencing anxiety. And so this anxiety will make the nausea and the vomiting worse. So it's like a vicious cycle. The hyperemesis causes depression, anxiety, and depression, anxiety will cause hyperemesis. So it tends to be a vicious cycle. And studies indicated that women who experience hyperemesis gravidarum tend to also experience high labor pain, and there's a significant relationship between hyperemesis gravidarum and also postpartum depression, and also baby born with lower weight gain or lower weight. I mean, logically, you would know that when women keep on vomiting, they don't eat enough, which means that they don't take enough nutrition. So when they don't take enough nutrition, what happens is that this lead to poorer weight gain for their infant. So there are various medical treatments available for women who experience this severe symptoms of hyperemesis. It could be other symptoms as well, not just hyperemesis. It could also just be that they do not have major symptoms during pregnancy, I mean physical symptoms, but they do have experienced some anxiety and some depression because of other unrelated issues, and these unrelated issues causing their pregnancy experience to become worse. And as you know, now during COVID, women tend to be very worried with what will happen with their pregnancy, and they tend to be worried that because they need to go for that regular meet up with the ONG in the hospital, and going to hospital is very worrying, and giving birth in hospitals will be very worrying as well. So even though they do not have any severe physical symptoms, what happens is that with situations that they can't control, this would make their anxiety level and their depression level to go up. So there are various medical treatments and also complementary treatments to help women to go through a better pregnancy or better experience of pregnancy. And hypnotherapy is one of these complementary treatment. Now, the history of hypnosis being used in medicine, for women with preparation for labor and delivery goes as long as 1883. So Santiago Ramon y Cajal is an ONG specialist who tried doing hypnosis. I think his wife was very brave. So he tried doing hypnosis on his wife because his wife had severe bouts of hyperemesis with each pregnancy. So with one of those pregnancy, he did use hypnosis and it was very successful. And that success was published in a paper. So what are the benefits of hypnosis during pregnancy? This would, as I said earlier on, about hyperemesis, it would lead to less experience of hyperemesis gravidarum, particularly if the severe nausea and vomiting are due to anxiety. Then, if the anxiety is reduced, the experience of hyperemesis gravidarum would also reduce as well. But a lot of my patients here, when they go through hypnosis, they tend to either stop vomiting altogether or the incidence of vomiting reduce substantially. And eliminating tylism gravidarum is a big word. I will come back to what is tylism gravidarum in a bit later. And also, when I was doing my study on hypnosis for pregnancy, one of the things that I noticed is that it eliminates leg cramps. Until now, I do not know, why was the reason. If you were pregnant before or you're currently pregnant, you know that leg cramps tend to be very normal during pregnancy. But with the hypnosis protocol that I used, it eliminated leg cramp. I couldn't explain it. My PhD supervisor um, couldn't explain it as well. So we don't know what is happening that make them experience less leg cramps or leg cramps stop altogether. So a little bit on my study. So I did it for my PhD. Recruited pregnant women at week 12 of pregnancy, and they were put into experimental group and control group. So experimental group received hypnosis treatment and control group did not. The point is that to compare whether hypnosis help women to experience better pregnancy. So these were the results of my study, and also similar results after the completion of the study with the patients that I've been taking for my hypnosis as well. It lowered physical symptoms, it made women more energetic, less experience of dizziness, heartburn, reduced backache, reduced shortness of breath, which is quite common, especially in the third trimester pregnancy. They reduce sleep difficulty in a way that it helps women to sleep better at night, and also reduce or eliminate leg cramps. And definitely lower stress, anxiety, and depression. So when I compare women in the experimental group and the control group, um, you know, uh, past research showed that the experience of psychological symptoms during pregnancy follows a U pattern. It's like a U, which means that first trimester, I'm so sorry. first trimester, first trimester is very high, which means that when women first started getting pregnant, um, they are very worried with the safety of their pregnancy, and because of that, the psychological symptoms are very high. And then it lowers in the second trimester. She's like, what a relief, because now I'm in the second trimester, so everything is over. So when they enter the third trimester, the symptoms will go higher again. The reason is that now they are preparing themselves for labor, and they're thinking that a lot of things are going to happen during labor. They will also be thinking that I'm going to give birth, and now after giving birth, I have to take care of my kid. I could be working, but then I need to go to work. Who's going to take care of my baby? So this would increase the psychological symptoms. So when I compare between my experimental group and the control group has the very nice U pattern. I forgot to put it in my slide. It's a very nice U pattern. But for the experimental group, interestingly, it wasn't in a U pattern, but it actually goes down. All the experience of stress, anxiety, and depression went from up high to way down, and it actually lower more during the postpartum period. So it shows that hypnosis did help women to get a better experience of pregnancy and also postpartum. So what is Tylism gravidarum? Tylism gravidarum is severe salivation. If you never heard of it before during pregnancy, or never experienced before, never seen before, it's not pleasant. It's like severe. Their salivation is almost non-stop. It keep on coming out. And then the worst part is that the tylism gravidarum comes with hyperemesis gravidarum, which means that on top of having saliva that keep on coming out, they also um, have vomiting, nausea and vomiting throughout the day. So you could just imagine the state of anxiety or that stress they would experience during this period. So I had one participant in my study who had the same condition. It was so bad that when she came to see me for the first session, she was carrying plastic bag. Reason is that then she could, spit out in the plastic bag. So I saw her spitting out in the plastic bag. And then she said that because she's working in a lab, and lab situation has to be very clean, right? So she said she was miserable, and it was a second pregnancy, and she was experiencing the same thing in her first pregnancy. So that for me, I'm excited in a way because it's a very good comparison. She experienced it before. It's not something new for her. So if I could do something to reduce or eliminate that condition, which means that hypnosis did help to do something for her. So if you could see in the graph here, her stress. So the one on the far left is the stress, and the far right is the depression. Stress level did go up slightly, but not too worrying during the fourth session, because I gave all my participants 4 hypnosis session at week 16, 20, 28, and week 36. So 4 hypnosis session, yeah. But interestingly, her depression level went way down. And second session, the incidence of tylism gravidarum is that the incidence of salivation decreased a lot, like really a lot. And by fourth session, it completely stopped. And when she went to give birth, because the first pregnancy, she said that when I was giving birth, I do not know whether to spit or to push out my baby. So she was very miserable. But for this one, when she went for her delivery, no salivation at all. In fact, I was there in the hospital, and her delivery was very fast. So I could say that, yeah, hypnosis did help with it. So for protocol for labor really depends on the nature of the symptoms. Again, protocol for pregnancy depends on the nature of the symptoms, because if someone comes to me with hyperemesis, the way I treat it will be very different than someone who comes with just anxiety and depression. So what would be the benefit of hypnosis during labor? It helps with lower incidence of cesarean birth, lower use of epidural, lower use of pain relief. In fact, they feel that they are confident enough not to ask for pain relief from the nurses or from the doctors. Shorten labor length, which means that labor goes actually really fast, to the point that when the hospital knew that, okay, this is hypnosis patient, they were very prepared, because they realized that after several incidents that women, even though it's first pregnancy, when they came into the hospital to PPUM, their birth goes like really fast. Lower preterm deliveries means that baby come out healthy, less pain experience, and higher neonatal APGAR score. APGAR score is the one that you may have given a cut after, if your experience gave birth before the weight, the breathing, the color of the skin of the baby. So they have higher APGAR score compared to the ones in the control group. Lower anxiety, higher satisfaction, higher self-confidence, and a lot more. Hypnosis preparation, again, as I said earlier on, it helps with pain reduction, help them to have more comfortable and easier birthing process. I'm going to go a bit faster here. Also, studies indicate how many sessions? For about 4 to 6 sessions. 3 sessions maybe if it's closer to labor. Helps postpartum? Yeah, definitely. It reduces physical symptoms. It reduces psychological symptoms. When I compared with my participants in the experimental control group, it shows that the one in the experimental group experienced only one person experienced postpartum depression, and that was because she had 5 other kids, and and all of them were very small, and she had to go to work, so she couldn't cope. But the incidence of postpartum depression in the control group were really, really high, and it was very concerning. So this is my current research. I just got grant from the Ministry of Higher Education to look at how hypnosis could help women with pregnancy-induced hypertension. So the study currently ongoing. So if you could see that I'm still doing recruitment for participants in this study. So thank you for listening. This is just a few minutes. If there's any questions that you would like to ask me. Okay, let me stop sharing.
So now is it can hear? Now can hear.
Yeah.
Okay, is there any questions you all want to ask with Dr. Zura? Okay, doctor, as you shown in one of the study, right, you say like during the pregnancy, the depression level and stress level during the follow-up that you have monitored, how actually they are like, if let's say their depression level is already reduced, and how they can do their stress management after their follow-up, if let's say they need to do any self practice or what, how?
Yeah. I teach them how to do self-hypnosis. I then only for pregnancy, I give them my voice recording because I usually don't want to take any chances. Don't want to give them they're giving excuses that I'm tired, I don't have time to do self hypnosis when I have my kids, I have to take care of my kids. So what I do is just to give them a audio recording so they'll be able to hear the audio recording.
Okay. Is there any like any other practices or physical activities that they can practice, something like breathing exercise or some
Yeah,
other techniques?
breathing definitely. Yeah, breathing exercises definitely. Any slow breathing exercise, any belly breathing exercises, that will be able to help them with better labor. I know that I think there's a technique, breathing exercise technique. Is it lamas? Yeah, I don't
Yeah.
do lamas. Uh, some nurses practitioner who did hypnobirthing before says that lamas doesn't really help, so I do not know because I've never asked them to try it before. Doesn't really help during labor. So what I do is that you see, even if they go through lamas, but if they still are anxious, depressed, with high anxiety, the breathing is going to be very erratic. So no matter how much lamas that you've practiced before
Yeah.
that, it's not going to work. So my technique is to make sure that the anxiety, the depression, everything is reduced. It's not just things which are related to pregnancy, but also things which are related outside of it. It could be that maybe husband and wife are having problem. They are having problem at work. They have been trying very hard and they are very anxious that to the survival of this baby. this particular pregnancy. They may have had miscarriage in the past, so there were trauma, and the trauma, the current pregnancy make them think about what happened in the past. So all this would increase their psychological symptoms. So I would remove all this first before I actually prepare them for labor. The actual technique for labor. So for me, when now their psychological well-being is better, has increased, it made my work much easier, which means that the labor preparation is much easier.
Okay, okay. Thank
Yeah,
you
so
so
I
much.
don't do all these lamas or all that kind of technique.
Okay, so for all the participants, I wanted to share that actually I did one session with Dr. Zura for hypnobirth for my second child. And actually, it's really helped me for my second child birth, because it was a bit like I was a bit anxious because baby's body weight was keep increasing, and I was asking for doctor to induce early, but doctor was like keep encourage me to go for a normal labor. And the one sessions that I attended, and as you said, we can just keep on repeating, hearing the sessions, and I keep on practicing that audio that we did that session. So it was really helpful, and I managed to do my natural birth during my 40th of week, even though it is induced, and it ended up with a very natural birth. And I still remember the pain was still bearable. I can imagine whatever during the hypnosis session, whatever it was like registered in my subconscious mind, it was really helpful for me to manage. I think I just took one dose of painkiller only, and almost near to the delivery, they just give me the gas to relieve the pain, because the baby was big size. But once we enter into the labor room, I just managed to push it as much as I can. Even during the push also, I feel like the motivation level and the feeling of overcome the pain is still manageable. So I just remember, I don't feel like the pain is going more and more, but it is still manageable with whatever the practice that I did with the hypnobirth. Okay, so I would like to say thank you to Dr. Zura, and I hope you all get some idea on what is hypnosis and how it's going to help in pregnancy, labor, as well as postpartum. So because many women is experiencing a lot of stress and also depression during the pregnancy and also after the pregnancy. So hypnosis is one of the complementary therapy that we can give to them. We can just say that hypnosis is more like we helping you to put into like a sleeping mode, but you are still aware of what you are hearing and what's happening around you. But we are just working on your subconscious mind to prepare yourself to face the challenges and to overcome all the barriers of depression or stress during your pregnancy as well as postpartum. So you can handle it with effective way with the help of hypnosis. So with that, I would like to say thank you so much for accepting my invitation to join us to share with us about hypnosis today. And also I would like to say thank you for all the participants who joined us to listen and get the knowledge about hypnosis. Okay, thank you so much. And I will see you
Thank you.
again with our future events. Okay, thank you, Dr.
Thank you.
Zura.
Thank you. Bye-bye.
Bye. Thank
Yes.
you, Ms. Jayanti. Thank you, Ms. Prima, and also Ms. Parameswari. Thank you for joining us. We will see you soon. I will leave a Google form here. If let's say you are interested with any of the topic, you can just update in the Google form, and then we will get back to you about our future events. So we do have like stress management and also Ayurveda home remedies for health and wellness, and also mental health management, and also stress management in workspace, because now the workplace stress management is one of the important thing that we need to look into. And we would like to give our best to the community to overcome these mental health issues. Okay, so I would like to say thank you so much once again. Just click into the Google form here, and you can just fill up the form and update us. Okay, thank you so much, and good night to all.
Thank you. Bye-bye.
Bye.